Good morning. Welcome to the Academy of Osteoporosis. This is the 10th lecture on the prophylaxis of osteoporosis. My name is Edward Czerwiński. I am retired professor of the Jagiellonian University and senior medical director of FutureMeds. Today I'd like to speak about the osteoporosis prophylaxis, and perhaps not everybody knows that we should start prophylaxis from the pregnancy and breastfeeding. I will explain why. Then about childhood, and what's the most commonly spoken about is osteoporosis prophylaxis in postmenopausal women. I mean the role of calcium, vitamin D, exercise, diet, and the summary. Because it's quite a huge subject, I use the chance to show you some bit of the Polish from the place of Bieszczady. It's in just the corner of the Poland, where you have the border between Ukraine, Slovakia, and Poland, the widest part of Poland. You are welcome. So the goal of prophylaxis is avoid the fracture. When fracture occurs, when the force applied over on the strength of bone. So there are two factors. One is the structure, and the second are the force. And those two directions we have to take into consideration when speaking about osteoporosis prophylaxis. Why from the why from the pregnancy? Because starting from the fetus, we are building peak bone mass and physical fitness. And so that's the aim of prophylaxis as long as we are growing and mineralizing our skeleton. In menopause women, first of all, we wish to sustain the bone, slowing bone down or even improve, and maintaining the fitness, what will result in fall prevention. Osteoporosis prophylaxis consists of calcium and vitamin D supplementation, exercises, fall prevention, diet, and healthy lifestyle. It is different from the newborn, men, young women, old women, and old men. I will talk about the pregnancy, because in pregnancy we have two people. One people is the mother, and the second is the child. It's after 4 days of fertilization, we are built of 16 cells. Our length is 0.2 millimeters, just compared to the thickness of the sheet of paper, which got 1.2 millimeter. And those two people live, and those young men will take everything from her mother, what she needs to her development, every substances, and of course, calcium will take from her bones. And please see that if from 0.2 millimeters, we have a delivery length 50. That means the length is 25,000-fold. There are huge changes in mother skeleton, both in pregnancy, 9 months, and breastfeeding, 1 or 2 years. I will not talk about this every changes, but the result is that mothers loses 11% of the vertebral body BMD and 7%. So if her bone are not good minerals, she might went to the era of the osteoporosis. And unfortunately, there are well-known cases with fractures, even multiple fractures. I have 3 cases. And this is the problem which should never occur, because if we introduce prophylaxis, it shouldn't happen. And I remind you that a baby draws from a mother 25 milligrams every single day. So if she hasn't taken this in the diet, the child will take it from her bones and may produce multiple vertebra fracture. So, and also, it is proven that the proper diet with the vitamin D and calcium helps to build a good quality skeleton of the newborn, and also that influence the peak bone mass, what is crucial in the future when we are 30, 40 in for osteoporosis. Recommended dose in pregnancy and breastfeeding is 100,000 international units of vitamin D and 1,000 milligram of calcium. And now we move to the childhood. We are growing up, women until puberty and men up to 18 years. And a newborn usually got height of 75 centimeters, and her skeleton is 0.5 kilograms, and a teenager will be really 12 kilograms. And in the 40 years old woman will be 15. So this calcium have to be given to her to build her skeleton. And so that's the curve, how it grows up. And if it is rapid growth and no calcium, that means no mineralization, so we got rickets. What the rickets is, there's the osteomalacia, but in childhood, named as the osteomalacia in adult. And that's me, and that's the ugly bottle with cod liver, with mom give to me every day. The taste, the smell was absolutely difficult to stand. But my mother have no mercy. And this is the thing in the 19th century, and even we have lamps with ultraviolet radiation to produce vitamin D in the skin. Here are the suggested dosage, just 60 milligrams of international units for vitamin D, and calcium, as you see there, just WHO generally accepted. Now, about activities, according to WHO, health activities in teenager means minimum 60 minutes per day of the moderate, that means brisk walking, active playing, or vigorous, that means running, fast cycling. And unfortunately, no new publication 2024 that only 24 girls at 11 years fulfills that criteria, and it is decreasing, unfortunately, up to 16, and doesn't make a better feeling that boys lose activity a little bit smaller than girls. And here you see that's the drama, because they will have very low bone mass and very high risk of osteoporosis. I would really, what is really what is really frightening, and what is frightening, that the global time teenager spends with the smartphone is 4 hours per day. 4 hours per day. Can you imagine that? I can't. All right. Now the big issue, postmenopausal woman, osteoporosis prophylaxis, and now we talk about calcium, vitamin D, exercises, and diet. Perhaps the lecture will be a little bit long because all this issue could be the subject for a separate lecture, but we try to squeeze it and give you in one piece. So we know that until puberty and 18 we are growing up and getting the peak bone mass, and growing up, and then our skeleton is mineralized. So we got the peak bone mass, and then we are losing. So the more big mass we have, the more safe we are. And we know that what are the influences. So there are the guidelines for International Foundation for the prophylaxis. So the calcium intake is 800 to 120 milligrams in dietary protein and sufficient dietary protein. And calcium supplementation is appropriate if it is below, and shown also in patients who have evidence of vitamin D deficiency. Regular weight-bearing exercises are advised and tailored need for the patients, and history of falls should be taken into consideration and prevented, because we know that almost every non-spinal fracture are results from fall. Supplementation of calcium. This is the National Institute of Health recommendation. You see, starting from 100 milligrams to 113 pregnant and breastfeedings. And here is the list which calcium content in the dairy products. So you can just copy that and use it for your practice. If you want to be precise, you can. If you want to be precise, you can go to IOF calculator, and you can precise estimate how much calcium that you have, and how much you have. You just can scan this QR code. So here is another advice I give to my patient, because I'm telling her, listen, the best way of calcium supplementation is the diet, and how much I give the content. But the easier is, here you have the 3 diets which contains 1,000 of calcium. It was prepared by my assistant, Małgorzata Berwecka. So you can just copy that and advise to your patients. There is a discussion about the risk of the heart attack and calcium supplementation, and nowadays it's out of discussion. There's one of many studies, the study of 467 patients, 10 years observation, and you have the women and men and hazard ratio, and definitely if we do calcium with vitamin D, there is no risk of heart attack. But if you give calcium without vitamin D, there is a risk. So that's the huge difference with many people just don't take into consideration. And the second question about supplementation are kidney stones. The bad news, it is unfortunately proven that dietary calcium, as the good news is that the calcium decreases kidney stones, and calcium supplementation increases the risk even by 70%. Why is that? Because we have too high content of the calcium, of the vitamin D, and is now binded and go to the kidney. So we advise the patient to take 1,000 milligram of calcium, preferably in the diets. If you need tablets rather in the morning, because you take in the evening, you keep your bladder full during sleeping, so that it's time for crystallization of the calcium, and take calcium with meats. You got the literature and you can just study. It's a quite huge issue in the history. So vitamin D, there are also wystrzady in a village called Zdynia. All right. So what for is vitamin D? It is needed for calcium absorption from the intestine, needs in the kidney for air absorption, is absolutely needed in bone formation and mineralization for muscle. So we are taking either from the skin, from the sunshine, and we can produce vitamin D on skin. Then it goes to the liver, and those 25 OHD3 we are assessing in labs, and the active forms is 125 vitamin D, and this is the form which is active. This issue is very complicated. There are more substances between, and if you are interested, there are many publications. Yes, we can produce vitamin D from sunshine. You need exposed to the sun 20% of body surface for 15 minutes during spring and summer, and will give you 1,000 of vitamin D. It changes from the race, I mean, color of the skin and ages. In wintertime, it's said that you expose 2 hours, 10%. 10% means face and hand, but this is possible. Otherwise, we can, if we have not enough exposure, we are giving vitamin orally. This is the corneliu, I remember well. And you see there are some in the diet. Unfortunately, in fishes, not much others. Dairy products, you just 14, even less in the others. So if we are like fishes, we can have vitamin D cover. And recommended level in Europe means below 20 nanograms of millets is deficient, 20 to 30 insufficient, and 30 to sufficient. Sometimes there are, but in other in the nanomoles, so this is the how you can calculate, multiply by 2.2, you got the nanograms. Maintain dose is 8 to 200, and the advice is that age over 65 through the year, below only November to April. And therapeutic levels even 10,000, and then it depends of the blood level of 25 vitamin D. This is the study. This is the slide most frequently presented nowadays, and that's the study from 1984 done by Chapuis on the residents of nursing homes. He had 3,000 women with average 84, and they were given vitamin D, calcium, and they were matched with placebo. The study was for 36 months, and he proved that calcium, vitamin D and calcium provide to be effective in 29 reduction of hip fracture and 25 reduction in non-vertebral fracture. Here we have a recent meta-analysis of 1,000 patients, 3,036 hip fractures, and they compare the risk of hip fracture in the lowest and the highest vitamin D content in blood. They have the table in nanomoles. I calculated to nanograms. So you see that there is a barrier of, say, 24 nanograms. We are talking in 20. And here we have the level of 25 OHD in blood, and here is the risk of fracture, of hip fracture. And you might be shocked that the coefficient is 1.58. That means that in the low vitamin D, the hip fracture risk increases 58%, almost 60%. So that is something crucial, really. And afterwards, no change. There is another study, how much deficiency influence the survival. And this 1,500 patients, 81 years of age, majority women, and their deficiency almost 60%. That means deficiency was as less of 20 grams per milliliter. And follow-up 5 years, of 15 months. And here we see the graph. Here is the days since operation, and here is the survival probability. And it was found that in the low vitamin D, there was increased mortality in women, 1.26, I mean 6%, but in men, almost 3 times more, 164. This is frightening for me as a man. And another news, very, very difficult, I think, because it was a vital trial in States. It was set to prove the wonderful beneficial effects of vitamin D. Huge study, really, 25,000 men and postmenopausal women, 67 years of age. They were given 2,000 unit vitamin D and 1 gram of omega-3 fatty acid versus placebo, 5.2 years follow-up. Results are really frustrating because here you have the curve of the risk of any fracture in years, and in those, and you see no relationship whatsoever, between placebo and vitamin D over the period of time, 6 years, and the same relates to proximal femur. So if there is a fracture and the observation time, no effect. However, there's a huge study, but if you watch that graph, you see that the diamond is on the beneficial scale, it doesn't touch 1. So in those group with some statistically significant, and that group of hip fracture is really significant. And this was just ignored in this paper, but maybe statistics. Why it's so? Many thoughts and speculation. Here's the study of 207 patients, and it was to falls and vitamin D. And what they found, that the falls really increase if the level is low and sufficient, then between 20 and 40 is perfect, and then raises again. But nobody found that there is increase of fracture rates. There is increase of falls, but not fractures. What does mean? I think that they are more active and they are more fit. So they prevent fracture, having been smart to avoid the injury. And this study proved that there is no effect of pleiotropic of vitamin D on any what was claimed before is very important in mortality, but you remember my slides of mortality. And cancer, acute respiratory, however, it is proven that is decreasing the infection in children. So there is a lot of discussion about that. I invite you to my next lecture. I expand this discussion. There is a lot of it, so please watch. And so we are on the era of changes, the guidelines, and the first for last year 24 comes from Endocrine Society Practitioners Guideline, and there are many recommendations on osteoporosis. Recommendation 2 says that general population younger than 50 suggests not supplementation. In older group, daily allowance is perhaps enough, 60 milligrams. And in general population between 50, no supplementation beyond the recommendation does a revolution. And we're watching the development of new guidelines, but please remember the U-shape, and this is probably the best answer in this answer situation. I invite you to the next lecture. It will be fully devoted to importance of vitamin D. And now about exercises. So in Roman times, the Decimus Julius Jovenis said, "Mens sana in corpore sano," what means healthy mind in healthy body. He was a Roman satirist. He was primary slave and was free. And nowadays, Polish doctor Wojciech Oczko, doctor of medicine and philosophy, court physician, the Polish kings, two, Stefan Batory and Sigmund Vaza, and he wrote that no drug can replace exercise, but exercise can replace many drugs, and that's true for every day. What are the results of physical activity? There are strong evidence that lower rates of all cause of mortality, coronary heart diseases, blood, high pressure, stroke, metabolic syndromes, type 2 diabetes, breast cancer, colon cancer, depression, falling. Also, there are strong evidence that a lower rate of the cardiorespiratory, body mass, general bone health, higher functional health, and better cognitive function. And there is a huge study of 495 individuals, 7 years follow-up, and assess how much years we can gain making exercises. They compare high activation, moderate to no activation, and you see how effective is a life gained, even 10 maybe with morbidity. And with that morbidity, you see the average is always towards expanding our life. So the more we move, the longer we live, I would say. We know how it's important in astronauts. They lose every month for a month to 5 BMDs, and even 9% during 6 months. And you watch those astronauts how they're exercising, but this not a problem resolved. How much activity we need? Say it should be between 6,000 steps to 8,000. We can divide activities to low, that means 500, moderate 7 to 8, and high 10,000. And here you see the advantage, and you see the less of steps is very, very bad, but after the 7,000, not much regain, and absolutely not more, about 10,000. I'm not telling that you can do more, you can do more, but there will be no measurable effect. We have two aims in exercises in osteoporosis prevention. The most important is for prevention, so it directly prevents the fracture. And the second is bone quality. And there is also a lot of misunderstanding. First of all, there are no magic exercises for osteoporosis, but we have remembered those two for prevention and bone quality. Bone quality means BMD. So far, there are no magic exercises for osteoporosis, and we use that kind of exercises we are applying osteoporosis are weight bearing, resistance, balance, Nordic walking, and dancing. And I will talk some words about them. You have to advise patients that safety is the always most important, is best to perform exercises under the guidance of physiotherapists and determine of set of exercises together. At home, depends on stage you are, how healthy you are. At home supervising training, repeat each phase about, say, 5 times. Exercise duration about 30 minutes. The set as often as possible, even every day, twice a week. But at least twice a week it shouldn't be less. And adjust to your abilities. Weight-bearing exercises, that means we are weight-bearing where you are standing, the body weight is stimulating osteocyte to stimulate osteoblasts to mineralize or to produce bone. And we have low impact. I mean, walking, brisk walking, marching, stamping, steady chairs, moderate impact, so high line, dancing, jogging, running, sports, and very high basketball, volleyball, and sports. It is taken from the Royal Society of UK. Resistance exercises are the best for BMD. And that means you are producing stresses to your bone, and there are many kinds of them. So it is proven that resistance training increases bone mass even in elderly. How we do have a tape, and it can be sitting, biceps, curl, overhead press, wall press, and many others. And here you have the situation about the resistance resistance exercises. There are very many of them, and you can find in internet a lot of them how to do it. Here we have the meta-analysis published in 2015, 1,000 papers and 176 postmenopausal women, and you see these diamonds prove that the resistance training improves BMD, and as I said, even in elderly. Various exercises also might increase BMD. This is the meta-analysis of 1,577 patients, and here is the increase of BMD of the lumbar spine and the femoral neck, and you see the diamond also shows that this is the truth. And now we go to the now we move for the balance exercises. These are really more important because might prevent falls, those prevent the fracture. There are many of them. We can just divide it for 6 chapters. One is static, means just one leg standing or tandem stand. Then we have dynamic, tandem walking, how we do. We put the toes to heel and so on. We watch the line. It's not so easy for elderly people. Functional, squats, steps, postural, high resist walking every day, and body-mind practices like Tai Chi, yoga, Pilates, and dances. Tai Chi is proven, dances are proven. Pilates got some publications. So here are the balance exercises. You can find this movie on our page, www.osteoporosis.pl. It was a mother of my assistant. Thank you her for doing that. The video is the quality as it is, but it's very instructive. As the practical, I think, is the best I ever seen. Tai Chi is something absolutely outstanding. For the last 30 years, there are well-known publications that this decrease falls, no doubts, and you see the meta-analysis, 3,040 participants, risk almost half, and here you see the diamond. So Nordic walking. I tell you, if patient asks me what kind of exercises I would suggest her, I'm telling her you can go to the physiotherapist and he will teach you. Then you can do your own. And what kind of exercises, she asked again. I said, okay, Nordic walking. Absolutely, absolutely. Because Nordic walking means that we are pushing the sticks, and if we run or walk, only 50% of muscle works. In Nordic walking, 85%. So 85% of muscle is working and giving impulse for our osteocyte. And this is the study of 800 patients, and was beneficial of the resting heart rate, blood pressure, capacity, consumption, and is very, very easy, and really over my patient does it, and every patient visit, I am making, of course, BMD every year, other examination in it, and I ask her whether she walks with sticks, and my advice is 1 hour twice weekly, and I check it on every visit. And I'm very upset if she said I have no time or doesn't like. There are some also you can buy equipment which can simulate the same at home which not every woman will accept sticks. And this is the walking, not the walking can improve the Polish study. And here is the T-score. So the smaller T-score, the better result. There's the medication only, synachic exercises, Nordic walking, and both. You see that from the base and the other, there is some improve of the Nordic walking, and even more with synachic was the baseline and after. And now we move to another huge subject, what the diet is. There are subjects, and there are very thick books on that. So we give you some general idea how it works. In the past, we're talking about the food pyramids. So the majority should be vegetables, then whole meals, milk, yogurt, and limited sugar, fat, and salt. Nowadays, there is a progress. We are talking about the dish plate of healthy diet. So it should Mediterranean diet, and is vegetable mostly, and the Mediterranean decreases fracture risk 0.7%. That's true. It's published. So go for Mediterranean diet. Now we came to healthy diet in WHO Cindy. And first, eat a variety of products mounted from plants rather than animals. Eat bread, grains, pasta, rice, potatoes several times a day. Variety of fruits, at least 400 milligrams per day. Maintain body weight between BMI 22 to 25 by physical activity, preferably daily. Control fat intake, no more than 30% of the energy. Replace fatty meat with beans, legumes, leftish fish. Then use milk, dairy products, kefir, soy milk, yogurt, and cheeses, but low of the fat and salts. Select food with low sugar, low salt diet, alcohol not more than 2 drinks per day. Food safe, hygienic way, and exclusive breastfeeding. There are, of course, most of them. I refer you to the WHO or your country guidelines. And here we have European commandments. Protein, 1 to 2 milligram per body weight and 20-25 grams per each meal. Vitamin D 800s, maintain the D level above 20 nanogram per millimeters, and calcium 800 to 120. And regular exercises, weight-bearing exercises 3 to 5 times per week, so except of Sunday perhaps. And now we at least reach the summary, and I'll just start from pregnancy and breastfeeding. So the whole prevention includes vitamin D and calcium supplementation for prevention, physical exercises, healthy diet, and healthy lifestyle. Osteoporosis prevention starts from the pregnancy and then in breastfeeding, as the second man inside the woman will take for her everything what she needs. So adequate vitamin D is essential. I remember that during the pregnancy and breastfeeding, women loses 11.25% of spinal BND and 7% of hip, what might cause spinal fracture. I know I have such patients. I don't know why it is not popularized. From birth to age of 14, bone mass increases tenfold. If you have no vitamin, there will be rickets, means osteomalacia, and adequate vitamin D, calcium, along with physical activity essential for building high-quality bone mass and the peak bone mass, which is as crucial in osteoporosis development in the next ages. Childhood belows the peak bone mass in adolescent, and unfortunately we observe decline in the physical activity of the 50% of youngsters fulfill the criteria of minimum exercises, and our youth spend average 4 hours per day smartphone. This is frightening. Adequate calcium intake is essential in postmenopausal women. It is approximately 1,200. Unfortunately, pharmacological supplementation increases the risk of kidney stones by 70%, while directly reduce that. Even funny, the more calcium in diet, the smaller risk of kidney stones. And supplementation with calcium plus vitamin D does not increase the risk of cardiovascular events. Maintaining in adults, maintaining optimal level of vitamin D in 20 to 50 is associated with reduction of falls, whereas levels exceeding that may increase that risk. However, elevated concentration are not linked in the risk of fracture, and this is a general agreement that that's the fact. Vital trial shown that vitamin D supplementation does not exert pleiotropic effects, does not influence, among others, the risk of cardiovascular diseases, cancer, depression, but it doesn't mean that vitamin doesn't act. That means that supplementation in this trial was eventually proven that it doesn't work. Endocrine Society clinical practice in general population said, a quotation, in general population, age 50 to 70, we suggest against routine vitamin D supplementation beyond the recommended dietary reference intake for this population. The query is whether there is vitamin D in the diet. Exercises and diet. The goal of exercises, first of all, is to prevent the fall, and because fall causes the fracture, resistant exercises have the greatest impact to bone mass, and weight bearing improve the fitness and help maintain BMD. Tai Chi is out of discussion, proven method of fall prevention, even half, and simple exercises and Nordic walking, what is my favorite, may improve the general fitness and have also positive effect on BMD. However, the publication are very scarce on that issue. Healthy diet, vegetables and fruits should be made half of the food intake, grain products, whole meal as well, and dairy products are advised, and calcium supplementation required for postmenopausal is 120 milligram per day, and this will be the best way to do it in diet. And studies show that the Mediterranean diet reduces the risk of proximal femoral fracture. Just go change your diet. Saying that, I want to thank you for your attention, and I invite you for your next lecture, and I will be happy to see your remarks, questions. So thank you, and see you again.